So I'm Helene Alexanderson. I'm a physiotherapist and a researcher from the Karolinska Institute in Stockholm, Sweden. And my research is focused on exercise in adult myositis. So it's both poly and dermato and inclusion body myositis. So I see patients in the clinic, and we have research exercise sessions in the gym and in the pool. I also have some research time, and then I educate PT students at the Karolinska Institute.
And I'm Sue Maillard, and I'm a physiotherapist from London, but my specialty is in young people, so under the age of 18, who have myositis. My master's degree dissertation was looking at the safety of exercise in young people with myositis, because there was a belief that exercise might be harmful, and we were able to show that it wasn't harmful at all. So we were able to change our practice and our policies with managing young people with myositis. And I'm also on the medical advisory board of the TMA, which is one of the reasons why I'm here as well.
Okay, so today we're going to talk about different exercise programs that have been evaluated for adult myositis. So I want this to be a really interactive session, and please stand up if you want to and try some exercises if you like. So don't feel that you need to sit down through this whole session. And I would be grateful if you could share, if you are exercising, if you could share your experiences, because I find that I learn a lot. I might know how, I might be the one who has evaluated these exercise programs, and I prescribe exercise programs all the day, but you are the experts on how it feels to exercise when you have myositis. So I would be grateful if you could share that with us and with everybody. Is that okay? Great. So I have some slides here, and that is just mainly to remind myself which is the next exercise. And there are pictures, I think they're filming this session, so it will be up on the website as well, and you can see the slides. So if anybody doesn't want to be filmed, that is fine. Just raise your hand, and the photographer will try not to get you stuck on the film. And Sue here has promised me to help to demonstrate, because today's session, I presented these programs briefly on this Thursday. And the point of this session, I think, is to show how you can adapt exercise programs to whatever difficulty you might have or a need. And if you have an example, or I have a very good way of doing a similar exercise, please let us know. And this is just a picture of the research group that I'm in at the Karolinska. So in the middle, we have so this is Professor Ingrid Lundberg. She's been a member of the TMA board, I think, for several years, and she showed one of the exercise programs in Vegas. I don't know if anybody attended that meeting. She is an outstanding expert in myositis, and she had, in the middle of the 90s, it said in the textbook that you should not exercise because it could be harmful. And she told that to her patients. But then there was a couple of patients who did not follow her recommendations, and they did, in fact, exercise, and they came in and did push-ups on the floor of her office. So she thought that maybe you can exercise when you have myositis. And so we got started in the middle of the 90s. developing some exercise program, and we have continued since then. So this is a translational, multi-professional research group with physicians who do most clinical research and people who do a lot of lab research, looking at muscle biopsies, what happens in the muscle when you exercise, looking at inflammatory markers. So the first program that we're going to show today is a home exercise program for Myositis that you can use either if you have a recent onset diagnosis with a high disease activity or if you're in a flare. And we think it's a good program to start with if you have never exercised before. Then we're going to talk a little bit about an exercise program for patients with IBM. Is there anybody with IBM? Okay, good. And then we're going to move on to exercise that you can do when you're in a more stable phase of the disease, when you have lower prednisone doses and in more established phase of the disease, in both aerobic exercise and resistance training. So this is the first home exercise program. Let's see, I think I need to... Okay, this is working now. So it contains of a few exercises that are targeted to exercise muscles that are affected with myositis. So the first is a warm-up, and we have shoulder mobility exercise, grip strength, the knee extensors, the shoulder muscles, and you see some exercises for hip extensors and hip flexors and the trunk muscles. And when we evaluated this program, both in patients with an established disease and with recent onset diagnosis, we could see that you can improve your muscle function and also your quality of life, mainly in the physical domain, pain and fatigue. And we evaluated inflammation using both, we measured CK levels in the blood, but we also did an MRI of the thigh muscles, and we did repeated muscle biopsies. And from all these analyses showed us the same thing, that there are no signs of increased inflammation. So even though you have high disease activity and you exercise, then your CK levels go down. So everything normalizes in the muscle. And this program has also been recently, we tested this program in a controlled, randomized control trial. So also compared to a control group, we could see that the exercise does not increase the inflammation if you have a high disease activity. So confirming the safety of this program. So if you can stand up on the stool. You should have a small one.
I've got a side on the chair, that's slow.
Yeah, no. But you can see the picture. So you go up with your right foot and down with the left. And you go up on the right, down on the left. And if you have a problem with balance, or you have problems climbing up on a stool, you can just do like this. Like so is doing. In a little faster pace so that you get your heart rate up. Very good. So you do this for about 5 minutes. You can take a short walk as well if you like, depending on where you are. And you can also use your arms. Good. I asked for some music, but they said no, it won't work. Okay, so you can decide how fast you want to go. If you feel that you're in a good phase of the disease, you can go faster. So you can start slow, and then when you feel that you have started your circulation up a bit, you can go a little faster. Okay, very good. Thank you. And when you're in the beginning of the disease, or if you have problems with your shoulder, you might have stiffness in your shoulder joints. Does anybody recognize this? So it can be if you're too weak to lift your arms above your head. So there are different ways. I don't know if you recognize this one. It's kind of a pulley apparatus. So I'll try to stand on here and look at the chair. Yeah. That might work. Yes, but okay. So Sue will hold on to the handles, and when she pushes one arm down, the other one goes up. So you can start carefully, a little bit at a time, and then you can increase the range of motion. How does it feel, Sue? Excellent. So this is a very good exercise if you are very weak in your shoulder muscles and you need to exercise your range of motion. And if you rest, if you sit there, you can also squeeze these handles for grip strength. Very good. What? These have a reasonable amount of resistance on them, so they're good. Okay. Does anyone want to try while we're carrying on talking? Because I can hold it. Yes. Good. Please. A bit short. And if you don't have this kind of thing to help you, you can lay down on your back, putting your hands together, and gravity will help you. And if you're laying down, it's even easier. Anyone else want to try? It's all on the website. They were put up, I think, this Wednesday evening or so they're all there. And you can also go in and see the film of this. That's it. You can squeeze the whole time, and then you can use the other arm to make it a little bit harder, so that you're pulling against your own system. Don't call me over. But anybody else have a go? Yes, do you have a question?
Ma'am, I have a question.
Yes.
Did you make those balls on that thing? Did it come that way?
It comes this way. You can have, I think, you can buy them both with the red balls and without the balls. So just okay. Oh, okay. I think they should be available with the... Yes, I think so. Okay. So maybe, Sue, if you would like to show how you can do this laying down as well, to exercise your range of motion. And I would say, if you feel that you have strong muscles in your shoulders, then you don't need to put so much emphasis on exercising the range of motion. But if you have some morning stiffness, having trouble getting going in the morning, this could be a nice exercise to do before you go up from bed. You look beautiful. Okay.
And it actually, if you think about it, and actually pulling your tummy and flattening your back at the same time, you could do some core central stability work statically, holding your torso still while you're still moving your arms. You can sort of do a 5-1 exercise. Of course, you can do nothing, just this is doing nothing, it's just lying there. But if you pull in your tummy and flatten your back and pull in your pelvic floors, then you can actually do some core central stability work as well as stretching your arms out, so you can do both together.
So this is how you can exercise your grip strength that Sue showed. But you can use a whole lot of devices to exercise your hand. Do you have any experience?
I've used B a lot.
Does it work well?
Very easily, more.
I like the therapy rather than the balls personally, only because the therapy, especially with the children, I've made up a silly little routine of making different shapes with one hand so that you can strengthen all of the little muscles in your hand by doing slightly different shapes. And the therapy, like the eggs come in different resistances, the therapy comes in the same amount of resistances as well, so you can start with very light resistance and then build that up as well. So there's a whole variety of different ways that you can use both. Neither is right or wrong, just different ways.
In Sweden, it's usually the occupational therapist who is giving out this dough. I don't know how it is here in UK.
Either physios or OTs, it depends.
I've seen like a sort of a spongy block.
Yeah. No, I mean they all do the same principles, and I think it depends on what you prefer and what you like. The problem with the therapy is it responds to gravity, so you can't leave it out on the table because it spreads and splats and gets it all in your furniture. So you have to keep it in the pot and be careful. Of course, with the pressured eggs, that doesn't happen. You don't have the same problem with that. So it really depends on what you prefer.
So we will talk a little bit about later how you can decide how many repetitions you should do of each exercise. But 10 repetitions could be a good way to start. And then increase. So the thigh muscles is another muscle group that is affected. So you can sit like Sue is doing and extend your knee. And you can work against gravity, like she's doing. Or you can put on an extra weight cuff. Have you seen these TheraBands? That's also a way to, if you attach one end around your ankle and the other end around the chair where you're sitting, the rubber band will give you an extra resistance. It's to give you resistance.
So you can tie it to a loop, and then you put one loop around the leg of the chair and one loop around your ankle, and then when you go to straighten, you're actually pulling it up. And do that.
Okay, this is working. Should
I'll do this. Would you like to try?
Do you have any knee problem?
And then that will be attached to the chair. Yeah, so then if you move back a little bit.
So that's it's perfectly fine to do it against gravity, but if you feel that that is too easy, you can buy a rubber band, and I think the yellow ones are the easiest, they give the least resistance, and they go up to black, that gives you a very hard resistance. It's just, I'm doing it without any weight. So at the first picture I have a weight cuff, and on the other.
But also,
With the first picture, you have, if you're sitting up as tall and as straight, and then you go to straighten your leg, if you don't have long hamstrings, you'll not be able to do it. So the other picture also helps modify that. So if you lean back, you take the stretch off your hamstrings so that you can use your quadriceps to a better range. So if you've got tight hamstrings and you can't get straight because it's tight at the back of your leg, you can always lean back a little bit and you'll be able to get the knee straighter. So you're working the right muscle, but your hamstring's not inhibiting you. Does that make sense? Cool.
And the next one is for to work with your shoulder muscles that are lifting your arm above your head. So you can sit on a chair and you can have an extra weight or a rubber band, or you can just work against gravity.
but of course, if you find it difficult to get to your feet by yourselves, then something like this will be difficult for you to do your exercises by yourself. Whereas a set of dumbbells might be easier for you because you haven't.
Sorry, if you have trouble getting to your feet by yourself, then actually you might want to get a set of dumbbells that have, you can get 1/2 kilo, 1 kilo dumbbells, and you can do the same action with also resistance, but then you don't have to struggle to get the band on your feet.
You don't have to have a straight arm, you can do like this. Like if you're going to pick something down from the ceiling.
So similar to the...
Yeah.
Yes.
And then we have the hip extensors. So you can lay down on the floor or on a bench. This could even work in your bed if it's not too soft. So you push down your feet and you lift your pelvis up. And you can make that a little bit harder by having your arms across your chest. That's the first. And then you can, when you can manage that for 10, 15 repetitions or 20, you can try to lift one foot. And it's very important that you don't drop your pelvis, the side of the pelvis that you're lifting. Can you show us? If you lift one foot?
And also, if you have both legs close together, it's easier because you're using both to help you up. If you take your legs slightly apart and do it that way, it's harder again, giving you a different type of workout to your core muscles as well. And then if you want your legs straight,
And then we have the trunk muscles, and here it's very important that you have your knees bent, otherwise you will put a lot of strain on your lower back. And if that is too hard to lift, you can put your hand behind your back, behind your neck a little bit, and lift. Yes. But just be sure that you're not pulling your head. That's very good. Have you tried this at home? Is this something that you do? Because in polyendurtomyositis, at least, you get weak in the neck muscles in front. And for that you can work at a C. You can see I'm just lifting my head up on the pillow and going down slowly. And if you're, yes, and the one in the middle, you can just activate your abdominal muscles and press your lower back down and exercise your trunk muscles. And if you're doing like I do, in the first picture, you exercise both your trunk and your neck muscles at the same time. They stay on the ground, so you push your lower back down against the...
Never to do sit-ups because it's hard on the spine, especially if you have osteoporosis, which I do, and they told me never ever do sit-ups. What's your opinion on that?
Well, it could be true if you have osteoporosis, if you're at risk of fracturing a vertebra. So then the one in the middle would be safer for you.
And then you can make...
Then you can make it harder by lifting your legs up. So you can do reverse sit-ups. So we have some children in our team who do also have osteoporosis and also some, fractures of their spine as well. And so what we do is we teach them to flatten their back and put in their tummy. And to start with, you just lift one leg and then the other, and you swap over, but you keep your back flattened. So once you've got good at that, so your spine's still protected, but you're still really working your tummy muscles. And if you're good at that, then you can lift one leg, and then lift the other, and put it down, and then down again. And you can see my back hasn't come off. So you flatten your back, put in your tummy, lift one leg, lift the other leg, and then back down again. I'm going to do that and talk at the same time, okay? And then if you get really good, you can build that up till you can lift both legs at the same time, and then you can make it longer. And that's a way of building up your abdominal muscles without putting any strain on your back. But if you do have dermatomyositis or polymyositis, and you need to strengthen your neck muscles as well, you will have to do something that actually makes that move as well. Otherwise you'll miss out that muscle group.
Okay, and the hip flexors get weak in all subsets of myositis. So one way is to do straight leg. And if you have a lower back problem and maybe osteoporosis, I would suggest that you have the other knee bend. So you will stabilize your lower back a little bit.
And again, if you do the same flattening.
The same flattening and pulling in your tummy, you're protecting your core central stability again before you lift your leg up. Otherwise there's a tendency to do this and not concentrate on tightening the muscles, whereas if you tighten the muscles, pull in your tummy and then do your straight leg raise, you've made your core central stability nice and firm as well.
And if this is too hard for you, you can sit on your chair and just lift the knee up, one knee at a time, as high as you can. And you can also lean backwards a little bit if that will help you to lift, if you lean back a little bit and lift. So these muscles are important, to lift your feet when you're climbing a stair, for example, or going uphill. Okay. Okay, so how you get started. It's very good to set a goal before you start to exercise. Decide what do I want to achieve? Is there a specific activity that I want to be more able to perform, or do I just want to get stronger in general? When you begin, think about having shorter exercise sessions, but maybe more often. So when we evaluated this program, we have the participants exercise 5 days a week. And that's what we get patients started on when they want to start exercise. And it's important that you do something for the upper extremity, and then you do something for the legs, and then you exercise your neck and your trunk, and then you do something else with the arms, then you do something with the legs, so that you feel that you don't overexert any muscle group. And when you're starting, so this is a scale that I usually use in my clinic. It's a scale where you rate your perceived exertion when you're doing an activity. So for example, I would ask the patient after each exercise, how exerting was it for you to do? So we did 10 in the beginning. And if that patient say, oh, it was a 1, it was a very light exertion, I could do this for an hour. So then I'd say, okay, you need some more resistance. So then we try with a rubber band or with a weight cuff. Okay, do 10 repetitions again. And we say, okay, this was quite more exerting, so I say 3, moderate. That is a good place to start. If you haven't exercised for a while, or if you have a high disease activity. And then you start your exercise, you progress, you feel hopefully that you get better. So then you can add on weights or repetitions until you say, oh, this is a 5, 6, or a 7. A very strong exertion. And it's normal to have some muscle soreness when you start exercise, or when you're putting on more loads, and that is fine. But I don't want you to rate a 10, because then you don't have any energy for the rest of the day, and maybe you stay in bed the next day. So try to avoid that, so you cannot go in slow with a low exertion and then slowly build up. So after 3, okay, now I want to achieve a 4. And next week you think, okay, this is working, I'm going to try for 5. And the little dot in the here, you can actually say, well, this was 100. If you felt it was really, really exerting. So this is something that you can use, and you can show it to your PT if you have the possibility, if you want to get started exercising. And it's a tool to progress your exercise. Let's see. So if you have a recent onset diagnosis, we have started like 4 weeks after you started on corticosteroids. And when you have exercised on about 4 weeks on a moderate intensity, you should be able to go up to 5 to 7. And if it's too strenuous to do the whole program at a time, you can divide. You can do half in the morning, half in the evening. And you can also combine this program with a walk. Are you out walking, anything? Or biking, or doing other physical activities? Good. So how is it to maintain your exercise habits? Is it hard? Why? What obstacles do you have? Do you want to share?
For me, sometimes, I have a loud voice, but for me, sometimes it's finding time, because I still work, and sometimes those days are long. So I walk on the weekends with the dogs, but I know that's not enough. So trying to find something to fit into the day. doing these, I think, especially at home. It's easier for me, I think, to do something from home than to go to a gym or even a pool. So.
Does anybody else want to share? Yes?
I have the same feeling where I know I do little walks every once in a while, but I feel it's not enough. And then when I do get a sudden burst of energy, let's say a few months after an infusion, I feel like I have to make up for that. And so sometimes I'll walk a mile or two and for 3 consecutive days, and then I'll get a cold or I'll do something. Can't do it for like another 2 weeks and then I can stop. And the cycle repeats.
Can be, yes?
Is not everybody has a high place like that, and not everybody can get off the floor. So can you do it on your bed? Is that just as good if you lay on the bed and do those exercises?
I would say the bed works for most exercises if it's not a water bed or a really soft bed. Sometimes if you have a dining table that is really stable, yeah,
you can online buy like potentially buy massage tables, you know, from Amazon and whatever else it is that you have over here. You can buy those types of, you know, sturdy types of table and a little footstool so that you can climb onto it easily and safely is one option. But I mean, for me, because I'm trying to motivate young people and their parents to do an exercise program on a daily basis, and they've got school and activities, and the parents have their own lives as well. For me, one of the most important things in setting an exercise program is making sure that that exercise program is pertinent to that person. So, for example, some of the children wouldn't have arm muscle weakness, for example, so I wouldn't put that in their program. I would concentrate on the muscles that were weak for them. So I think the thing is that things like walking and swimming and cycling and all of those types of, I call them complex activities because they're using your whole body, are really important types of exercise for you to do regularly. But these types of exercises should be part of your treatment for your myositis alongside your medicines. Because, and anyone who's been to either of our talks throughout the last few days, the most important factor is that muscles do not get stronger unless you train them. And the body is very, very good at adapting to keep you moving. So what happens is you end up moving when you're walking and cycling and climbing the stairs. If some of your muscles are weak, those muscles won't get used because the body will kick in some other muscles to take over. And all you end up doing is making those muscles strong, and other muscles just carry on wasting away and getting weak. And that's not necessarily related to disease activity, that's deconditioning. So you need an individualized exercise program for you to do on a daily basis that I think is really easy, that, you know, takes tiny bits of equipment that you just slip into doing and get into a good routine, and then fit the things that take a bit more effort, like going for a walk or going swimming or, you know, going to the gym and those types of things on top of that. They're both important, but they both do different things. And I think people get confused thinking, I'm going to do a walk and that's my exercise, but that's only sort of scratching the surface of the things that you really need to do to treat your myositis. If you want to manage it in the, you know, so that you minimise the effect it has on you. Does that make sense?
And while you're out walking and if you have the goal to improve your aerobic capacity, there is a way to calculate in what heart rate range you should be when you're walking. So you calculate 220 minus your age. So I'm 45, so in that calculation my estimated maximal heart rate would be 175, I think. And then you calculate 50% and 70% of 175, and I think that I came up with between 87 and 122. So if you're within this range of heart rate, then you're working on an intensity enough so you can actually improve your aerobic capacity. A question?
Yes. For those of us who have very limited mobility, or we can't walk because we don't have the balance or the stability, can't walk rapidly enough to raise our heart rates, is there any suggestion for any other alternative?
Yes, I've been talking to several people with IBM today, and they find that aquatic training helps them because it's much easier to move in the water, and they can even jog in the water, and they can use their arms and paddling, and that raises your heart rate. You can, if you're able, you can bike on a stationary bike, or you can use an arm bike, or a special bike that you can even have in your bed, laying down. You can attach your feet to pedals while you're sitting down, and you can exercise. So there are lots of ways. Or you can, have you tried Nordic walking? Do you know what that is? Or you're walking with sticks. So it's like, almost like skiing.
I think that's a bit special to your area of the world. No, we don't do it anywhere in England, and I haven't seen it anywhere else either.
Okay.
The other thing I would say to that, because we've been talking about exercises for strengthening, but you can, if you're at a level where you can't walk very fast, and you can't get on an exercise bike, and all of those things are really difficult for you, you could still use the types of exercises we've been showing here, maybe starting without resistance but going a bit faster. So rather than slow, so if you do something slow and controlled, you're actually making that muscle work harder, and you're making it get stronger and more effective and more controlled. But if you went a bit faster and maybe added in a bit of an arm work as well, to start with, that would be a place where you could actually be getting your body moving. You could do the same thing with some things, some exercises lying down. And again, if you've got a bit of speed up and keep up with those repetitions, and instead of doing 30, you're doing sort of 50 or 60, that would also get your heart rate up, but in a safe way, so that you can still do your aerobic capacity. But I guess both of us have a message, is that you really do need a physiotherapist who can help you be imaginative, to come across those challenges that are pertinent for you, and come up with the starting place so you can build up on that. Because I had a gentleman yesterday who had interstitial lung disease, so his lung capacity he was struggling with to be able to get his heart rate up. And I'd suggested to him about learning some deep breathing exercises and some breathing exercises to actually work his intercostal muscles. You could do some things that have got a little bit of resistance in them. So, and of course, when you're always a bit out of breath, what we always end up doing is sort of shoulders up to your ears and breathing up here, and we forget to breathe in our whole sort of lung capacity. So working on something about your breathing while you're doing these exercises as well is a really good way of training that combination to start with. And then as you're getting stronger and more controlled with your balance, you'd be able to then take that to the next level of something a bit more exciting. That's like Nordic walking.
Okay. You can have this in Finland. Okay, so you can push yourself forward a little bit, and working with your arms as well will raise your heart rate even more. Very good for the balance, yes. So maybe people can try this later, if you like.
I hear lots of people have had some challenges with their balance as well. Is it just in standing, or is it in sitting as well? Standing and walking. Because there's a technique called rhythmical stabilizations that we tend to use sometimes in clinic, but that's something you could teach your significant other to help you with. If I don't, can you be my model? Of course.
So we have the light. So you can start with sitting down, and then if your sitting balance isn't great, what the person, your significant other person will be doing is putting a bit of pressure. So you've got to keep sitting still, and they're going to change the pressure so you don't move. Keep still. Okay. So you keep still. Whenever I put the pressure, you don't let me move you. Okay? And they just keep gently moving from a different angle. And what you find is that you bring in your balance muscles in order to control your stability. You stand up. And you can do the same thing standing. Of course, if you were really unstable, you could put a chair in front of you so you had something to grab onto, but you can do the same thing. Don't let me move you. Don't let me move you. Keep it there. Keep it there. That's it. Don't let me move you. You see, it's quite hard work, but that way you'd really be working on your balance and your posture and your stability in a safe, controlled way, so that you can build up those muscles that you need for then taking to the next stage to walking. Does anyone want me to try it on them so they know what they feels like? Just standing on that street. Anybody else? Go on, Nick. I'll show you.
So, which muscles do you felt that you exercised now? I found that I worked quite a bit with my feet as well and my calf muscles.
What you're doing is you're just keep changing pressure, but don't do the same thing because you'll get used to go, oh, you're going there next. So you're running. Yes, and you start off nice and gently, and then as you get stronger, you can be more forceful with your resistance and with the pushing. So then don't let me move. That's it, don't let me push it. It's hard work, isn't it? It's something really simple. We can do it on each other. Good, yes. That's gently. But then as you get stronger,
Like shoulder.
yes, and then of course, I presume you know each other quite well, so then you can take it to moving your trunk as well, so that you're really, challenging those muscles to keep you nice and still. So you can't move. And keep it fast, keep it moving quite quickly, and keep changing it so that you can't guess where the next move is going to go. Okay? And then you can do that for 30 seconds and then you'll have a rest. What you'll find is over those 30 seconds, these muscles kick in more and more because it gets easier and easier to go, right, I really can't move. It takes a while for your body to really stay still. So sorry? No, you do it every day, but it doesn't take long. You do it every day, and you'll start to notice things quite quickly, and you'll notice that you'll be able to put stronger and stronger pressure on. So it's all a way of building up balance now. Anybody else want to try? Do you want to try? Yes, you do. I do it just sitting down. Oh, well, just as well sitting down. Okay, so you sit still and don't let me move you, okay? So keep still and don't let me move you. That's it, keep still, don't move you at all. That's it, keep still, still. Yeah, you're doing a good job. Sorry, I'm a therapist, I have to keep saying the same things again. My kids just think I'm automatically nagging because it's part of our training, isn't it? It's like, keep moving, keep doing this, keep doing that. Well, I'm not nagging, I promise.
So I don't know if anybody of you have tried the run keeper or registering what you're doing in an app or exercise diary. So that can help you to see, okay, what was my goal? Okay, I reached my goal, what is my new goal? And you can see how far did I go when I started, and maybe 3 months later you walked a double distance. So that, I think that is kind of a way to motivate yourselves to keep on exercising.
And there was a lady
Who said that
she had on her wrist one of those pedometer type things, and she'd set herself the target of, I think it was 4,000 steps or something, and on good days it was easy for her to do the 4,000 steps, but on days when she felt more tired and it was a harder day, it gave her motivation to push herself that much harder, but still do the 40,000 steps. So it was a really good way of her going, oh, hang on a minute, I've been sitting still today, I'm feeling tired, I've only done 1,000, I better get up and do something different because I'm not going to make my 4,000 steps today. And that was, I thought, a really interesting, you know, helpful technique for her.
A pedometer app on your iPhone, it's just you have to constantly carry it with you. But we were surprised one weekend how much we walked, we didn't realize.
And you can get ones that are wristbands that are attached to your phone so that you can work out with what your heart rate has been and a whole bunch of really complicated stuff. So they're all really sort of up and coming new technology that you can use on a day-to-day basis.
Okay, before moving on to the IBM home exercise program, do you have any questions about anything that we've said so far? Fatigue?
I think my biggest obstacle is fatigue. I have to plan my day. If I'm going to wash my hair and take a shower and I have to put product in my hair, I'm done for the morning. So, any suggestions?
Well, I think if you wash your hair, you will get some good exercise for your shoulder muscles, and what I would like to say is just put 2 exercises in your home exercise to begin with, or just 1, which is the most, so you figure out which is the most important, which is my weakest muscle group, the thighs maybe. So then you can have an exercise where you stand up from a chair and sit down, and stand up and sit down. Or you do this with a weight cuff or just straighten the knee. So,
And do you sit in the shower while you're washing your hair? Because that might be another way of making it a little easier for you, so that you don't exert quite so much energy in balancing in order to wash your hair, and so you could, you know, have one of those proper stools that you could put. Is it in a shower or in a bath in the shower? Yeah, so you should be able to get a stool that you could put in the shower, so you could sit, and you could, you know, break up even what you're doing with washing your hair. So for example, wash your hair, and then you could put the product in, and then you could sit there and just, you know, take 5 minutes while your product's working, just having the shower on you, and then just break that activity up with you sitting and taking less energy to do those things, and a bit more rest, allowing the product to make your hair be beautiful, and then when you come out, you might not feel quite so lacking in energy. But the thing, I mean, hot water and showering is also quite zapping of energy as well, so it's being aware of it's not necessarily only the task, but the whole caboodle of being in hot water is quite tiring. So, and then of course, if you've mainly exercised your arms, what you could do is still do an exercise program for your legs in the morning, so that sort of revitalises your energy and your oxygen supply by actually doing something with your leg to pump your blood around your body again, and you might find that helps with it too.
thank you. So this is a program that was evaluated for patients with inclusion body myositis. So it was evaluated in the form of 16 weeks exercise, but doing this exercise program twice a day. And from this open study, we could see it was shown that improved muscle strength and ability to stand up from a chair and to walk without increased disease activity. So the first exercise is just, you can use a chair with an arm support or without, depending on if you need any help to get out of your chair. So you stand up, and then when you sit down, you try to do it slowly. And you go up. Good. And go down slowly, slowly, slowly. So you can think about that. Maybe there is something fragile. You don't want to break it when you sit down. Okay? That will really put your thigh muscles working.
But make sure you don't end up with your knees locking together to push you up, and that you keep everything nice and straight and facing forwards, so you keep your knees apart.
So is it okay to sit in a higher chair?
Yes?
I know like the church and different places I'll stack my chairs, so it's easy for me to
Yes.
stand and sit down. So it works as well with this exercise?
The higher chair you have, the easier it will be to raise. And the opposite, if you're sitting in a sofa, that is really hard to get up. So you have to find...
Is it working as well if the chair is higher?
If it's easy for you to get up from the higher chair, then it doesn't do that much in terms of strengthening your muscles. So you should find the height of the chair that you're able to stand up and sit down, maybe 10 repetitions, but you should feel some exertion. And then there is exercise. In the study, they were holding soup cans of 360 grams, I think. But you can use, in this picture I have a little weight cup, or you can have a bottle of water, and you decide how much water you want in the bottle, depending on how strong you are. So that will target your wrist flexors. You get weak when you have intrusion by myositis. Or you can have a rubber band. If you're sitting down, so put the rubber band under your foot, and then have your arm leaning against your thigh, and lift your hand. So that will kind of exercise your grip a little bit if you're able to grip the rubber band.
And exercise with the stick stands as well. But I think, again, if you have trouble getting to your feet, then something like a dumbbell or a bottle of water, something easy to hold, is a very good way of being able to do that nice and easy. That's something to get down.
And here we have the quads training again. So in the first picture I'm sitting without any resistance, and as we showed, you can use a rubber band or an extra weight cuff if that is too easy for you. If it's too hard and you're not able to extend your knee fully, then you can try and do straight leg raises instead, and try to keep your knee straightened. So that will work. You will train both your hip flexors and your thighs. I would say it's just as effective if you're not able to extend your knee fully. Yeah. So I think you should. The other one would be good for you. Yeah. So then you try to have your knee as straightened as you can.
And if you pull your ankles up towards you, then that actually encourages the knee
Knee to be straighter and for that muscle to engage more. If you have your toes pointing down like a ballerina, it actually disengages your quadriceps. So having your toes pulled up towards you, locking your knee as straight as you can to do the straight leg raise, you're actually doing a multitude of muscle groups, which makes it even more effective.
And then there are some biceps curl, where you can also use the rubber band or the microphone, whatever you can find. it's important here that you have your elbow close to your upper body, so you're not out doing like this. And it's important that you try to resist, not drop your arm, drop your hand down. So you do it slowly and controlled, very good. And then, I don't know how you experience this if you're weak in your distal muscle groups in the legs. So one way is to stand in front of a chair if you need some support, and you go up on your toes.
Do you do that with shoes on or shoes off? Only that I make sure the kids take their shoes off.
Okay.
The pictures with shoes on, that's what I was asking.
It's a good question. I think it works both ways, or do you have another angle on that?
Oh, I think it depends on the shoe, to be honest. If it's something really supportive, then I think you're less effective with this exercise. So.
Yeah, you're right. So this is, we talked a little bit about, maybe it's different what kind of muscles, if you need to exercise the strength or if you need to improve your endurance. So the calf muscles you use very much when you're walking, if you're walking uphill, if you're climbing stairs, and maybe that's something that you want to be able to do for a longer time. So in this program it's stated about 1 minute to go up and down. But when you're exercising your quadriceps or your the biceps or the quadriceps, you need a lot of strength just to get up from a chair. Or if you want to try to come up from the floor. So maybe you need to do some more strength training on these muscles. So few repetitions and as high load as you can manage. But maybe 10 repetitions is what you should aim for. And this one you can, like Sue is sitting, can just, if you're not able to lift, to do 2 liftings when you stand up, you can do it when you're laying down. Or when you sit on the sofa watching TV, you can work with your feet up and down. And then it's the same for the shoulder muscles, with or without any extra resistance. And then you can stand against the wall. Maybe I'm out of camera here. But you can lean against the wall, and then you can lift your toes. Can you see what I'm doing? Or you can sit on a chair and lift them up.
And if you're really weak and you can't lift your whole body weight when you're standing up, you could lean forwards and you can do the same thing on your tiptoes here, just put a bit of weight through your knees and then still do the up and down on tiptoes as well. There's always an easier way than, I mean, we show you sort of one way, but actually, if you can't do that, there are many other ways you can still exercise the same muscle group in a way that you can achieve to begin with. So it sort of, that's why it's really helpful to have a therapist that you can at least start you with where you need to start from, and then help guide you. You know, even with the children, I wouldn't see them more than once every 6 weeks. Set them a program that makes it harder for them over the 6 weeks. We see them and reset the program. So it's not something you have to go every week for, or 3 times a week. What you do at home is going to be the most important thing, but it's getting someone to just to help guide you and how to tweak those exercises.
So I would say, even in this case, it's very good if you have the possibility to get started together with a physical therapist who can measure your muscle strength and your ability to walk 30 meters And we've used a test called sit to stand, where you sit on a chair and then you're supposed to stand up as many times as you can in 30 seconds. And there you can adjust the height of the stool. I'm sorry, that's something else. A stool. Stool is a chair in Swedish. So you can adjust what height you need to be able to stand up, and then you be sure to register what height did you have on the bench or on the chair when you did this measure the first time. And then when you have exercised for about 6 to 8 weeks, it's very good if you can come back and do these measures again. And by that time you may be able to progress number of repetitions if you feel that this program is working well. And then we have also assessed after the 16 weeks. But I would say that you should start with doing the exercise program once a day. And here you can also use this Borg scale. So for each exercise, and after having done the whole exercise program, it shouldn't be more than a 3 when you're getting started. But after 3 weeks, you can try to do the exercise twice a day, the whole program. Maybe once in the morning and once in the afternoon and in the evening. And how to continue. With the patients in our clinic that have tried this exercise program finds it very difficult to sustain twice a day exercise for 16 weeks. So what we have been trying to do is you try to achieve 16 weeks and then you do something else. Then you go back to some aquatic training or doing something that you feel is really fun. And if you felt that this program helped you and had that your strength were improved, so then maybe you 6 months later you want to, I think I'm ready for a new 16 week. So I think that is a way that we feel could be working. I don't know, do you have any thoughts on this?
I know that one of the hardest things is trying to find a place to do a lot of exercise.
I was going to say, I think one of the hardest things is trying to find a place where you can do the aquatic exercise, because most pools are so cold, it's counterproductive.
Exercise, if you do the same exercise on land, are you going to get the same benefit or some of it?
Excuse me?
The same exercise on land that you do in the pool, is that okay?
Yes. It's just, I think that would be just fine if we just it hasn't been evaluated in any research study. No. I agree, it's, I've heard it several times during this meeting that it's hard to find a pool that is working, that you can get in and get out of as well.
Can I just say that we did a study in young people comparing aquatic exercise with land exercises, and actually though the children preferred the aquatic exercises because they were all done in hydrotherapy pools, so they were all hot pools, and they enjoyed that whole experience. So their impression of how much they enjoyed the exercise was much greater in hydrotherapy. But actually the patients that only did dry land therapy got much better outcomes than those that only did aquatic therapy. So as in strength training specific for your muscles, what you do on dry land is more effective for your muscles than what you do in water. I mean, water's still better than doing nothing at all, but I think, and also you need to be careful because water changes the way you use your muscles, because water pushes you up and gravity on dry land pulls you down, so it changes the way you use your muscle control. And so aquatic training can be very good for a variety of different things, particularly aerobic type work, and making you feel much more able because the water's holding you up. But actually, in being precise about muscle strength training, you can achieve much better results on dry land. But lots of people prefer aquatic training because it's lovely and warm and all of those nice things. So, of course it is. But of course, then you've got the added, the difficulty of going and getting undressed and in the water and then out of the water and dried and home again, and that takes 2 hours versus a home exercise program that takes you 15-20 minutes. So I'm not putting anyone off aquatic training, but if you can do land training and aquatic training, then you've got the best of both worlds.
So just try to find something that you enjoy to do. Like aquatic training or swimming or biking, walking, whatever you can find. And to benefit your health, or reduce the risk of cardiovascular disease, type 2 diabetes, it's important to be physically active most days of the week with regular. Can be what you do at home if you're cleaning the house or doing...
I'm not sure cleaning the house is a really
No,
nice
but
fun
if
thing
you're out
to
in
do.
the garden or like everyday activities, I agree, that example.
And my thought process was also about exercise is really good for improving your mood and your emotional well-being as well, which is why when you suggested housework I was thinking,
Sorry.
that's not going to make me feel better. But exercise in itself is also very good for your circulation and your digestive system, as well as your mood and emotional well-being as well.
Okay, so the programs that I will show you shortly now is if you're in a more stable phase of the disease. For this type of exercise you can do with any type of adult myositis. And this type of program we've seen has been able to increase the aerobic capacity in all types of myositis. But we've done most studies in polydermatomyositis, and here we could see improved strength, improved ability for activities in daily living, improved quality of life. So the participants exercised 3 times a week for 12 weeks. What we could see, so we saw all these improvements after 12 weeks, and then we followed everybody up after 1 year. And what we could see was that only the muscle strength in the quadriceps, that was the only parameter that was still improved, which I think shows that you need to be persistent to maintain the improvements that you gain. And so here it was biking, but you can do whatever activity that you feel is fun. Walking, swimming, aquatic group, dancing, horseback riding, golf, Wii games. I have a few patients who borrow their kids' Wii games and they're doing different kinds of sports which raises their heart rate. It's really fun and they get tired in the muscles. So, but to improve your aerobic capacity, you need to be physically active on this level, on 50 to 70% of your maximal heart rate. You need to do that 20 to 30 minutes, 2 to 3 days a week. We have also looked at some intensive resistance training in the gym. And this is has been tested for patients with established low disease activity polydermatomyositis. So the participants exercised in 3 sets of 10 repetitions, and they lifted a weight that you can lift 10 times, but not 11. And that is about 70% of your maximal strength. And here we could see improved muscle strength, and endurance, and we could also see reduced activity, disease activity and inflammation. And I want to point out that that goes for this type of exercise as well. We see reduced disease activity, and genes regulating inflammation is downregulated after this type of exercise. And we could see increased number of capillaries in the muscle tissue. So there are a lot of good things happening in your muscles when you exercise. And of course, you don't start this type of training on this high load. You go in maybe doing 30 repetition maximum, so that you end up on the, you know, the scale that I mentioned, on 3, and then you start to increase the loads, lower the number of repetitions, and maybe after 4 weeks you're up on this type of load. So always start gently, progress slowly, and listen to your body. Does this feel good? And also here, make sure that you don't do all the arm exercises in sequence and then do all the leg exercises in sequence, but that you vary. And we found that it could be, we had a patient with severe arthritis in her hands, and she actually got a little bit higher pain during exercise with these heavy loads. So that is something that you need to be observant, mindful of. Thank you. And it could also be if you have a heart condition, if you have severe osteoarthritis, osteoporosis, I'm sorry, then I wouldn't recommend you to exercise on this high intensity. But as long as you feel well during and after exercise, and you see the benefits of improved physical capacity, you can keep on doing what you're doing. If you go into flare, if you're exercising on this level and you go into flare, then you have to adapt what you're doing. Don't stop exercise, just adapt to how you're feeling. Lower the intensity. And it's okay to rest from time to time. Everybody needs to rest. So try to find a balance between activity and rest. And we talked about setting goals. And also, it's important to stretch the muscles that you have been working out. And here are some examples for the neck muscles. Do you stretch? What muscles are important for you to stretch? Do you want to share?
I try to stretch my neck muscle as much as possible, and then after walking, the leg muscles, like it's shown on the bottom picture, every time I walk, I that one spot.
At lunch, we were all talking about something we haven't heard, and it's neck issues. We seem to all have neck issues. So if you can give us more ideas of neck exercises, that would be good.
I think I hear a lot of my patients talking about neck issues as well. And I think the way that you did when you're pushing me around, you can do that with the neck as well.
Same thing, just with the neck. The faster you go, the more work that you have to do. The person that's doing the exercise has to work, so that's one way of doing it.
works really well in your bed, better than perhaps on something so hard, is that
You're lying down. I feel like some singer now. There must be some singer that like lies down in Pink or somebody. And you lie down. What you're trying to do is the base of your skull, you're pushing that down into the bed. And what you do with that is you just lengthen and relax all of the muscles in your neck. And it's a really good one, certainly first thing in the morning, last thing at night when, first thing in the morning is not woken up, and last thing at night when it's really tired, but you're not lifting up and you're not pushing down. You're literally just putting the back of your head down onto the pillow, the bed. And that way you're just stretching everything out, and you'll find that doing a few of those nice and slowly and controlled, then actually that makes the neck feel much more relaxed and comfortable. And of course, if you were going to get up when you've got a neck problem, you want to roll over and not sit bolt upright.
So you were talking about neck issues. Do you have difficulty lifting your head up when you're lying down? I have a theory. I don't know if this is the truth, but if you're weak in these muscles in front that are affected by the myositis, the rest of the muscles need to work more to keep your head up. So I usually suggest exercises like lifting up, going down.
Don't let your head tip up. So keep your head down when you're doing that.
And you can use a rubber band. You just stand on a rubber band and you hold both ends. Then you go up and down. So you get more circulation and maybe you get stronger in your neck muscles.
And of course, if you can't do the lifting your head up from a flat surface, you could have 2 pillows to begin with, so that you're lifting from an incline, and then making sure you tuck your chin in. Because in dermatomyositis in children, that's the first muscle that goes, is their neck flexors. They can't lift their head up at all. So we spend a lot of time retraining that muscle. So I mean, some of them are so weak that we'd start from this position and then just, they're like on a reclined bed. And so then they just have to lift up and down. But it's making sure you lead with your chin, but you don't lead like this. So it's keeping the patterning of movement normal. So if you were doing it from lying flat, instead of doing this to lift up, you lift from the top of your head. So it's always chin tucked in, lifting from the top of your head this way. And if you can't do it from flat, start with pillows. So you're on an incline, and just keeping that pattern. You don't have to lift a lot, it's just starting to get those neck flexors working. And if you practice, they'll start to come back, and then you can take a pillow away, and you can do it from that position, and then always get down to the end. Or you can then do the full range of movement.
Okay, any more questions?
Anything specific? It's difficult giving this type of talk because both of us are used to working on a one-to-one basis and seeing somebody, assessing them, analysing, deciding what they need to do, setting the exercise programme. So in giving out a generalised approach to exercises is quite challenging. But hopefully you've been able to pick up some of the principles and the ideas and in fact, hopefully the message that exercise is super important and unbelievably helpful.
It is an important part of your treatment. It's as equally important as your medications, of course, is very, very important to push down the inflammation, but exercise is also very important. So see it as a treatment, something that you can treat yourself. This is a way to maybe control your symptoms, something that you can do for yourself to feel better.
Is that good for it?
Yeah, yoga puts, it depends, there are lots of types of yoga. The ones that I've tried, you really exercise your strength, the core muscles and your arms, and the neck, and the legs. It gives you flexibility as well. So as long as you feel that this is working for you, you get stronger and you feel good. So then yoga is your thing.
Pilates is another good option.
What?
Pilates.
Pilates. Yeah.
Yes, that's another good option. I mean, at the end of the day, all of the exercise is really good, but there's two types. There's one about your well-being, your fitness, you know, having fun, joining in with other people, doing, you know, Pilates, yoga, those types of things. And then there's your specific treatment that's like, you know, it should be prescribed like your methotrexate or whatever medicine you're taking. Your home exercise program, I believe, should be prescribed for you for that. And then other types of exercise are bonuses. They're added to that to help with your function. They're not instead of. So all of our children with myositis, they have a specific exercise program, and we encourage them to do whatever sport and physical activity they enjoy. And I know for me, I make that the most important thing, is that they enjoy it. And if they want to do something bizarre, then I just have to help them be strong enough to do whatever it is that they want to do. But, you know, it doesn't matter to me, I don't mind. If they want to play rugby, we'll get them strong enough to play rugby. If they want to, you know, horse ride, if they want to do judo, we don't have any limits. We just have, they have to work harder to do that activity than their friends who don't have myositis.
Okay. So I hope that you go home now with some new ideas how to exercise. Thank you all for coming and listening.